Gradual numbness, tingling in your feet or hands, and lack of coordination can all be symptoms of peripheral neuropathy. But what exactly is that condition and what can be done to treat it? Well, Dr. Richard Busch of Busch Chiropractic is here now to answer those questions. Thanks for joining us
Thank
today.
you for having me.
So why don't we kind of start with what exactly is peripheral neuropathy?
Peripheral neuropathy, very simply, is death or damage of a nerve. Okay, there are a lot of different types of neuropathy or peripheral neuropathy that we can have. Most of the time, it's sensory, but you can have some motor effects where it's actually affecting the nerves that cause movement in joints. So the sensory types of things that we see are things like numbness or tingling or a burning sensation. Sometimes there's no pain at all; it's just the numbness and tingling. But at the same time, it can get really, really cold, or we could have a hypersensitivity where anything that you do to irritate that nerve or even touch it causes a great deal more discomfort and even pain at times.
Now, can it be in different parts of the body?
Yeah, actually, it starts, generally speaking, farthest away from the brain. So what we're looking at is, in a lot of cases, in the feet, and then we start to see it in the hands. And in both cases, it can actually progress up toward the rest of your body. Some other types of neuropathy that we might hear about are things like diabetic neuropathy, where patients are diabetic, or some of these neuropathies may be caused by chemical toxicity. Okay, some drugs that are out there, like statin drugs, a lot of people take for their cholesterol in their heart. But then along with that, even pressure on the nerve at the spinal level can, or even at any level, can cause some damage to those nerves that way.
So then what are some of the treatment options?
Well, some of the treatment options are, first of all, to look at from just a nutritional standpoint, what we may need to do to supplement. Along with that, if they are having a problem with one of their drugs, like a statin drug, we need to have them talk with their medical doctor about getting off of that. But then along with that, there's some things like low-level laser therapy and some of the other nutritional supplementation that we use that actually help increase the oxygenation, help increase the blood supply, and ultimately help take care of any of the discomfort or the numbness or tingling. The biggest problem that we have with patients that have neuropathy are not just the fact that they can't feel themselves, but also along with that, balance issues. The number one cause of serious injury for patients over the age of 65 is a fall. And so that's something that we have to really keep an eye on.
So if you're feeling some of those symptoms, definitely don't ignore it. Get it checked out.
And the thing is, it's very easy for us to work with. And in many cases, we can actually almost completely eliminate the problem.
Wonderful. Thank you, Dr. Busch, for joining us today.
You
You can learn more about Busch Chiropractic by just calling the number there on your screen. Now I'll send it back to Pat.